Hello, good evening. I am Isha Thakur and I welcome you to Librate's YouTube channel for another live session. Today, in this session, we have the privilege to host Dr. Tarun Kumar Saha, Senior Consultant and Head of Nephrology, Apollo Hospital, Hyderabad. He has 26 years experience post DM from the most reputed PGI MER Chandigarh Hospital. He has been awarded many awards, including scholarship in 3 World Congress of Nephrology meetings and 1 Transplant Congress meeting. He has many publications in national and international journals to his credit as principal investigator. He is also a faculty in Indian Society of Nephrology, Association of Physicians of India, Indian Society or Organ Transplantation, and other regional meetings. He initiated first in the private sector to start the transplant program in eastern UP and has done the first dual marginal cadaveric kidney transplant in Hyderabad. With all of his experience and expertise, he is going to explain one of the most important concerns of kidney transplant patients: risk and outcomes of COVID infection in patients on dialysis versus kidney transplant patients, among all of us and all the related queries. Welcome, Dr. Tarun Kumar Saha, and thank you for your time. To our viewers, kidney disease or its insufficiency can affect the ability to patient's body to clean the blood, as kidney plays an important role like filtering waste and excessive fluids from our body, which are then excreted out of our body through the urine. If the kidney functions are lost, all the waste material gets retained within the body and builds up in dangerous levels. Once a patient is diagnosed with it, it has to undergo either dialysis or kidney transplant depending on the severity of the disease. During the next few minutes, Dr. Tarun Kumar Saha will be explaining the basic information related to the kidney disease, comparing its treatment options, dialysis, and transplant with advantages and disadvantages. COVID risks on patients or other related clinical details on the same. My request to our viewers who have tuned in: please feel free to ask your questions in the comment section and we will take them later. Over to you, Doctor.
Thank you, Isha, and a very good evening to all the viewers. COVID-19 has affected our life severely, very badly in 2020. The kidney patients who has got end-stage kidney disease, they have options for treatment in the form of either going for dialysis or kidney transplantation. Those who choose to do hemodialysis, they have to come to the hospital 2 to 3 times per week for getting the dialysis done to remove the toxins from their body. There is a significant amount of confusion and risk and doubt that whether those patients who are on maintenance hemodialysis will be better off to be kept on hemodialysis or they should be offered a kidney transplantation during this pandemic time. There are pros and cons for staying either in dialysis or going for kidney transplantation. In next few minutes time, I will be discussing the pros and cons of staying in dialysis versus transplantation during the COVID-19 period. First, here are a few disclaimers. As we know that the COVID-19 is a new medical entity, a new disease, and the researches are scanty because it is less than 1 year of duration that we are having this disease with us. The current presentation is based on current available information and personal experiences. Audience are advised to consult their own treating doctor before deciding the course of treatment. And as you know, in the practice of medicine, that every case is different. So the opinion needs to be individualized and a patient needs to see their own doctor before taking the decision. The points which I'm going to discuss in next few minutes are that what is the outcome of dialysis versus transplantation in the pre-COVID era, before the COVID started how the transplant and dialysis, compare each other for the renal replacement or kidney replacement treatment. Then we will discuss few points about the risk and preventions of COVID-19 infection in hemodialysis versus transplant, and what are the differences of COVID-19 infection in outcome in hemodialysis versus transplant, and how, if we decide to do kidney transplantation in pandemic time, how we take stringent precautions to plan kidney transplantation. And last but not the least, since the vaccines are going to be available soon in our country as well, so how we can give vaccination to our hemodialysis patients or transplant patient against COVID-19 infections. So first, coming to the outcome of dialysis in versus transplant in pre-COVID era, if you can see the dialysis can replace only 10 to 15% of a normal kidney function, whereas a transplanted kidney can do 50 to 85% of what a normal kidney does. People on dialysis have to follow a rigid diet, and the dialysis patients have typically low energy level, whereas in transplant patients, after a successful transplant, can have a much liberal food, drinks in or fluid intake, and people after transplantation, their energy level becomes near normal. And the problem of coming to the dialysis unit 3 times a week will also not be there after a successful kidney transplantation. So the quality of life remains much better in a transplant patient as compared to a dialysis patient. If you can see the outcome of the staying on maintenance hemodialysis or versus the kidney transplantation, as you can see, this line is tells us about the survival in dialysis. In terms of here, this graph shows the survival of the different modes of renal replacement therapy. Here it is being compared between dialysis versus live donor transplantation versus the cadaveric transplantation. The best results we can achieve, that here we can see that the 5-year survival is 92% in case of a live donor kidney transplantation. The figure is about 76% in cadaveric transplantation, whereas the figure is only 58% in case of patient who stays on hemodialysis. So hemodialysis not only gives a good quality of life or a better quality, transplantation not only gives a better quality of life as compared to hemodialysis, but the survival is also much better in kidney transplantation group as compared to the people who are staying on hemodialysis. And this survival benefit of kidney transplantation is more pronounced in younger patients than the older people. Although even in older people to the age group of 60 to 74 years, the transplantation outcomes are much better than the hemodialysis, as you can see here. But of course, the difference is more pronounced in the younger age group people persons. Here also same, the relative risk of dying after while the person is staying on dialysis versus transplantation, the relative risk is, say for example, is 1 with waitlisted people who are on dialysis. The relative risk comes down after transplantation, and as you can see, with a period of about 300 or 400 days, the relative risk is much lesser in transplantation group as compared to dialysis. But we must remember that even in pre-COVID era, during the first month, the relative risk of death is little more immediately after transplant. That is related to the surgery and its related complications and immediate immunosuppression and rejection related complications. After the initial period, the survival is much better in a transplant as compared to the dialysis. So in transplantation, the advantages are freedom from dialysis. There is a dietary freedom, ease of work. They do not have to come for dialysis thrice in a week. Sense of well-being, better survival, and it is mandatory for people who do not have a good vascular access for regular hemodialysis. There is the ease of successful pregnancy in transplantation as compared to dialysis. The cost effective also becomes better in long-term basis and favors transplantation than hemodialysis. But There are few disadvantages of transplantation, which are like risk of surgery, particularly the first few weeks, infections, rejections, post-transplant diabetes because of the drugs which we use to prevent the rejection, the immunosuppressive drug, they can create diabetes, or in the future, the immunosuppressive drugs can predispose the patient to formation of cancers. In medical term, we call it malignancies. So the more chance of cancer in the long term, and of course, there is a little more risk of developing diabetes after transplantation, those who are already not diabetic. So now we see that what are the risks and how can we can prevent the COVID-19 infection in hemodialysis and transplant patients. The transmission in hemodialysis uh, can be due to the repeated exposure after week, because patient has to come for hemodialysis 3 times in a week, and they are exposed while they are going to the hospital during the transportation time, or while they are staying in the hospital for 4 hours hemodialysis and half an hour before or after starting the dialysis. So about 5 to 6 hours they have to stay in the hospital, and the risk of getting the infection in from dialysis unit, from other areas. During the 5 to 6 hours of stay, they need to eat food at the hospital, they have to use the washroom at hospital. This all increases the risk of transmission in hemodialysis. And as you know that the COVID-19 infection comes from the close contact or respiratory droplet or aerosol, or it can rarely be airborne also in a closed space. If somebody stays in a air conditioned, then the droplets can propagate and infect the person, and rarely the stool and urine also can carry the virus to other patient. Now here, I just wanted to point out that when person travels in a car, it is important to keep the doors of the windows of the car open to prevent the infection of virus from the other co-passenger or the driver. Now, this slide shows that the trajectories of droplet and aerosol infection in closed car. As you can see, that airflow pattern in the inside the car is like this. And if a person has infected and has got COVID, other persons in a closed car has a very high risk of getting the infection. Whereas if the person wears the surgical mask versus the person wears the N95 masks, the prevention will be better with N95 masks. But because the car is closed, there is still some more risk of transmitting the virus to the other passengers. But if the car window is open, as you can see that the expired air goes out of the window, and there is a because of ventilation. So even if there is an infected person, there is a chance of infecting the other. But if the infected person wears the surgical mask, or better if the person wears the N95 respirator, the risk of infecting the other persons becomes very, very minimal. So it is recommended that the person, one who travels for dialysis room or for any work, goes out of the house and use a vehicle, the vehicle windows should be open, and everybody preferably should wear N95 mask to reduce the transmission risk. So as far as the outcome is concerned between the dialysis versus the transplantation, the problem of dialysis is that if a person gets COVID infection who is on dialysis, he or she needs to come to the hospital thrice in a week to get the hemodialysis done. And if a person is actively infected with COVID virus, it is not recommended that person should travel frequently to a vehicle and to frequently visit the hospital and different areas. So any hemodialysis patient who gets a COVID infection needs to be admitted in the hospital because the person requires frequent dialysis. And there is more chance of symptomatic respiratory distress in hemodialysis patient, because in hemodialysis patient urine output is generally not good, and these people tend to accumulate water in the lung, and COVID infection involves the lung. So there is more risk of lung gets compromised because of end stage renal disease with hemodialysis patients. And the some drugs which are used in COVID-19 infection needs to be avoided in hemodialysis patient or needs to be used with very much caution. So there are problems if a person gets a COVID-19 with hemodialysis, whereas the risk of transplantation may be less after 1 month of transplantation because the persons are not coming out of the hospital like thrice in a week hemodialysis situation. They are, if the transplant is a successful one, they do not need to come out of the hospital at all. So as they are not coming and visiting the hospital, the risk is minimal and there are less risk of getting the infection. Now, if they get the infection, they can have uh, uh, sometime more bad outcome that I will discuss in the next slide. But it is in the mainly in the first month, if they get the infection, that means immediately after the transplantation, during the first month, if they get the infection, the outcome can be poorer. And but in other, once the person completes 3 to 6 months of transplantation period, the outcome is not worse as compared to the hemodialysis patient. And person may not require, most likely they do not require admission, as we see in hemodialysis patient, they need to be admitted if they get any amount of mild or even serious COVID infection. So if you see the outcome that EDTA, European Dialysis and Transplantation Registry, which was published in Kidney International recently, showed a 20% mortality. That means the death risk both in dialysis and transplant. So although there are different studies in different areas, but the outcome seems to be similar in both dialysis patient and transplantation. So as far as outcome is concerned, there is uh, nothing to choose between the two options of kidney failure treatment, but the risk of getting COVID infection is much, much less in transplant patients, as I have discussed and emphasized the point repeatedly. And if the patient gets a COVID infection immediately post-transplant period, uh, even then people do survive. Majority of them, in fact, do survive. And from India only, there are 2 cases who are reported who had COVID infection after transplantation on day 7 and day 19. And Dr. Ashay Sungre has reported this in American Journal of Transplantation in June 2020. Both the patients who developed within 3 weeks or 4 weeks of transplantation, both of them survived. So there is not that much of a sort of poor outcome that a person gets um, COVID immediately after transplantation. There will be very fatal. No, not that way. But they can also be treated. Although the risk of dying in first 1 month is relatively slightly more than the people who are on dialysis if they get COVID. And the risk of, as I've explained, the risk of getting the lung edema is more in the dialysis patient. So now the question is that when we try, is there any way that we can sort of stratify the risk and decide what to do on, on a calculator or a mathematical way? So Massey et al. Tried to sort of invent a calculator which they say that can identify the risk of whether to stay in dialysis better or stay in go for transplantation is better. So this can be seen in the website of www.transplantmodels.com/covid_sim/. So here they have taken the parameter of community acquisition risk, then added acquisition risk on staying on wait listing, then risk of getting COVID infection in transplant patient, and then so many other case fatality in transplant, case fatality, or staying on dialysis, the patient characteristics. There are various parameters, and they have found that in most of the situation, it is better to go for kidney transplantation. And say, for example, if we say that the risk of COVID infection in the community is low, that is 1% per month throughout, That means in dialysis population, say for example, 1% patient gets COVID positivity, and it remains, or it is expected to remain in the same way. And then we see the other parameters. We will see that the 5 year survival in this model is 88% versus 86%. So kidney transplantation is better than staying on dialysis. So immediate KT is depicted in this red line, and the dotted light blue line is staying on dialysis. Staying on going for transplantation has an advantage of for survival. Similarly, if we change this parameter and we make that there is a more risk of developing COVID at present, that is in terms of 5% per month risk of getting COVID, those who stay on dialysis in next 1 to 6 months, and after 6 months the risk will be reduced to 1%. Say for example, as we are seeing, the pandemic is number of cases in India, at least according to the statistics, is coming down, and with vaccination the risk may come down. If you take this model, even then we can see that staying on dialysis versus going for kidney transplantation, the kidney transplantation is likely to have a better outcome than dialysis. Even if we make the case fatality rate more or less. So in both the cases, here the case fatality rate was increased versus more. Generally, case fatality in dialysis or transplantation with COVID will be more. So even we increase the case fatality from the previous slide, which was say low as general population versus 10%, or even if you make it 20%, this graph will be split further. So the staying on dialysis versus transplantation, this according to this model, going for transplantation has got added advantage for survival advantage. So when we talk about when we plan for the kidney transplantation, we need to take these stringent precautions so that we do not get COVID infection immediately post-transplantation period, that is the first 1 month period. So we do all sorts of testing, COVID testing repeatedly 2 times before the surgery is planned, and we take the history for the donor and recipient, and any history of doubtful history of having any suggestion to have COVID infection for last 2 weeks period, transplant cannot be done. And COVID testing to be done as close as possible before transplantation. We need to do a better immunological workup, and we need to choose the correct patient who will be able to sustain the transplantation immunosuppression and surgical risk. So that we do for all kidney transplantation patient. We do a thorough examination and thorough investigations to see the suitability for the transplantation. The patient needs to be educated properly before they undergo transplantation, and patient has to be put on strict isolation, preferably for 10 to 14 days before transplantation, and they need to come for hemodialysis only in the night shifts to prevent the chance of getting COVID from the other patients or from the hospital. All hemodialysis, we tell them to come in the night session. Hemodialysis to be done by 2 only designated staff, and they should plan their eating before or after the hemodialysis so that they do not consume food in the dialysis room. And dialysis room preferably be well ventilated. Both dialysis staff and patients should wear personal protection equipment during dialysis, and they should travel in a vehicle with open ventilation. The window should be open, and all instruction to be given for admission. They should get admitted to the kidney transplant unit directly without going to the reception or any other area. All the instruction, all plan has to be done before transplantation. And we need to do a patient education session 2 weeks prior to transplantation. We need to teach them about the way how they can wear the proper personal protective equipment like mask, hand washing techniques, social distance, and etc. They need to be taught about self-monitoring for sugar, blood pressure, temperature, oxygen saturation, intake output monitoring, which are very much important after transplantation. The education as much as possible should be given much before transplantation, so the patient should not get exposed to the health educator or the coordinator or the nurses within 2 weeks prior to transplantation. 2 weeks prior from before transplantation, patient should be exposed to any other people as less as possible to reduce the risk of acquiring COVID infection. So few words about the live transplantation versus the cadaver or disease donor transplantation. In live transplantation, we can keep the donor and recipient under strict isolation 2 weeks prior to the transplantation to prevent them getting any infection. But in case of a cadaver transplantation, that is not possible. Cadaver transplantation is done in emergency when the donor is available, brain dead donor is available. So, but we need to take the history for the donors exposure to possible COVID infection patients, or in any history of fever or any history of cough or any symptom suggestive of COVID infection in the donor. And in case of any doubt, we should not accept the cadaver donor who may have a COVID infection. Although we do go thorough checkup to the cadaver donor and we do COVID testing to the cadaver donor, but any history suggestive of acquiring or having in coming in contact with a COVID infected patient would warrant that donors should not be accepted for transplantation. So stringent precautions to be taken so that we do not land up COVID infection after transplantation. So coming to the last topic, that is the vaccination. As you know that few vaccines are already available in USA or in European countries or in Russia, and they are vaccinating. All these vaccine which are available in abroad are not live vaccines, and the vaccines which are being under trial in India, they are not live vaccine. Both all these vaccines can be given to both dialysis and transplant patients. Immediately after transplant, we don't give the patient vaccination. Generally, after 3 months, when their immunosuppression is less, we give the vaccination. And in dialysis patient, we can give the vaccination. Mind that if we give vaccination to dialysis patient, they should wait for at least 1 month after the second dose or the last dose of vaccination before going for the kidney transplantation. 1 month window period is needed before they plan the kidney transplantation. So in summary, I would say that transplantation is the best option for renal replacement therapy. Risk of acquiring COVID-19 infection in hemodialysis is more than stable transplant patients after discharge. During period of hospitalization for surgery, risk of getting infection may be more and outcome may be poorer during the first month of transplantation. The decision to go for transplantation or stay on hemodialysis depends on work profile of the patient, presence of serious comorbid conditions, and feasibility of adequate hemodialysis as an alternative is present or not. So taking into multiple factor into consideration, the decision has to be taken on an individual basis, but overall transplantation seems to be a better option for renal replacement therapy, even in the pandemic time. Thank you very much for your attention. And I believe that there is no question can be a stupid one. And I would welcome for any questions or comments or suggestions from the audience. Thank you.
Thank you so much, Doctor, for providing us with such insights over this particular problem. Now we'll take some questions from our viewers. So, first question we are getting from our viewers, Doctor, is that if a dialysis patient was suffering from COVID and he has recovered also, so after how many days can the patient undergo kidney transplantation?
Yeah, I just briefly touched upon about this point that if a patient gets a COVID infection, they should wait at least 2 to 3 months before undergoing transplantation. Actually speaking, earlier people used to recommend that they can go for kidney transplantation uh, two sorry, about 3 to 4 weeks after getting COVID infection. But now there are some recommendation has come that for normal population, not the dialysis population, the decision to undergo a major surgery after having COVID infection depends on whether the patient had a mild COVID infection or serious COVID infection. In case of a mild COVID infection, 6 weeks is the safe time that one can think to do a surgery. But again, it all depends on the how emergency is that surgery. If the surgery is not emergency, then one should wait for 2 months to 3 months, because we are seeing post-COVID symptoms coming in a lot of troubled way. People are getting breathlessness, cough, and many other symptoms. So one should wait at least 6 weeks before they declare themselves absolutely fit and then go for kidney transplantation. Generally, kidney transplantation is an unplanned one. So I would recommend that 2 to 3 months is the ideal time. I would say, in fact, 3 months. If a person got COVID and require intensive care unit, it is 3 months. And if a person gets a COVID on dialysis and suffer only for a few days of fever, no need of any intensive care treatment, then 2 months is the minimum time. That's my suggestion.
So, doctor, we all are aware that COVID affects our respiratory system. That means it affects our lungs. So, if we talk about its long-term effects on kidneys, then what are its long-term effects on kidneys?
Well, this depends on whether the person has got an underlying kidney disease or not. In normal population, those who are not diabetic, are not having high blood pressure, or no previous kidney disease, COVID infection, although can cause acute kidney injury, but they tend to recover, uh, and they may develop future kidney problem after 6 months or 1 year, because that is the normal for normal population. But if a person has already got some amount of a mild or moderate kidney disease due to diabetes or hypertension or other because of other reason, then if that person develops COVID infection, then there is more chance that the person's kidney function will deteriorate during the COVID infection. And once the person recovers from COVID infection, the kidney function may or may not recover completely. And in fact, my personal experience is saying those who have a moderate kidney disease, and if they get COVID infection, they are becoming serious kidney disease and they are temporarily requiring dialysis. After that, although they are recovering from dialysis, but their previous kidney function is not being achieved. Even if their previous kidney function is being achieved, they have a risk of developing further deterioration in kidney function in future. So COVID definitely affects the kidney. Sometimes it is in subclinical level, sometimes it is in clinical level.
So, another question we are having from our viewer, doctor, that how can COVID-19 affect transplant surgeries?
Well, when COVID-19 came to the world from February onwards of this year, the transplantation program throughout the world was halted partially or completely from the month of March or April. But when the people realized that staying on dialysis is no safer bet, then people started doing kidney transplantation again from the month of May onwards. We also had that problem. So we also stopped doing kidney transplantation from the month March onwards. And after a lot of discussion and weighing the pros and cons, we decided to do the transplantation from June onwards. And we have done transplantation from then, and patients are doing well. So the surgery, which transplant surgery, which came to a partial or a complete halt throughout the world, but the most of the places in the world now they have restarted transplantation, both live and cadaver transplantation. Initially, only cadaver transplantation people are interested because people were waiting on on dialysis. They did not have donor, and if a cadaver, if he waste, it's a waste of two kidneys. So wasting kidney is not good because there are lakhs of people waiting in hemodialysis to get a kidney. And when we have a proper prospective cadaver donor and we don't utilize it, it's a wastage of kidneys, which is not good. People are sort of not doing in dialysis. They can be given these kidneys and they can survive. So I think even if there is a risk of first few weeks after transplantation, but we got to weigh the pros and cons and then decide. So the whole world now has restarted transplantation, both live and cadaver transplantation.
So, doctor, talking about treatment options. So, what are the treatment options available for COVID patients with kidney injury?
See, when COVID patient develops kidney injury, the primary treatment is you treat the COVID. If you treat the COVID successfully, the kidney injury also will recover. May or may not be completely, but it will recover. And the same is true from lungs. If a patient gets a COVID with pneumonia, you treat the COVID, pneumonia will recover. But there can be a sequelae, the post-COVID symptoms what people are getting because of sometimes lung fibrosis, sometimes other reasons. So the treatment largely depends on the treatment of COVID infection, which currently is in the form of a steroid and remdesivir, or some other new drugs are being investigated, may come in future. I am not going to discuss the COVID infection treatment per se. I'm going to stick to my discussion on the kidney patient, end stage renal disease patient dialysis, hemodialysis versus transplantation. And sometimes the COVID infection patients gets acute kidney injury due to the dehydration. So when we hydrate them, give them fluid, and modify the dose of the drugs which are needed for COVID infection treatment, or some secondary infection like antibiotic and all, we treat the patient's volume properly. And if the person requires dialysis temporarily, we can give dialysis also. So dialysis, first is fluid therapy. If the fluid therapy does not cure the treat the kidney injury, then sometimes, rarely, we are doing dialysis also those patients who are admitted in intensive care unit with COVID infection.
So, another question we have from our viewers, doctor, that if a patient is having COVID and that patient is, undergoing dialysis treatment, so can that patient stop the dialysis treatment for some time or for some short period of time?
No, most likely no. See, if the person has got good urine output, then, and the other parameters like blood potassiums and bicarbonate, they are stable, they can remain without dialysis few days or few weeks, depending on the patient's kidney function. But those patients who have urine output which is less than 1 liter in 24 hours are advised not to skip the dialysis, because skipping dialysis will have more chance of developing water in the lung. And if that person develops COVID, it is going to be risky and serious. So I would recommend not to stop dialysis. If the urine output is good, maybe from thrice a week, one can go to twice a week dialysis. But going on to stopping the dialysis totally is not advisable unless the creatinine is not very high and potassium is normal, urine output is good, more than a liter, and many other parameters are suggestive that the person can skip the hemodialysis. The alternative to hemodialysis is peritoneal dialysis, but there are issues with the peritoneal dialysis as well. If patient goes for peritoneal dialysis temporarily, that is a better option to prevent the COVID infection rather than hemodialysis.
So, doctor, if we talk about patients who are not undergoing any dialysis or transplantation surgeries, so these are, healthy adults. So, what are the chances of developing kidney problems if that person is suffering from COVID-19?
I mean, if the person does not have any kidney problem, what are the chances of having kidney due to COVID? That is the question, I believe.
Yes.
In that case, I would say the chances of COVID infection, kidney injury with COVID infection is very less actually. Depends again. If you have a mild COVID infection, chances are very less, very unlikely. They may have a very mild rise in serum creatinine, maybe due to dehydration, but the chances of kidney injury with mild COVID disease is very, very less. But those who get severe COVID infection, particularly those who require ICU admission, 20 to 25% per people are likely to have a significant kidney disease, and half of them, or maybe more, may require even dialysis. So mild kidney problem can be present even up to 25 to 30 also percent of intensive care unit patients. But uh, But dialysis requiring COVID, what we are experiencing in India is about 10 to 15% or maybe 20% COVID-19 infection in normal kidney people. Okay, they may have mild rise in creatinine that generally reverses with IV fluid. I'm not, I mean, one can, they are also acute kidney injury, but significant kidney problem is to the tune of maybe 25%.
Okay. So coming on to the last question for the session, doctor, do immunosuppressive medications increase the risk of complications from COVID-19?
Yes, suppressive medicines which we use after transplantation, they do increase the risk of COVID-19 infection. But we must remember that in after transplantation we use generally triple three drugs immunosuppression. One of them is steroid, and steroid per se is the treatment of moderate to severe COVID-19 infection in normal population also. So what we do when person develops a COVID infection after transplantation, um, we try to sort of decrease the dose of uh, proliferative agent like mycophenolate, MMF, or azathioprine. They decreases the WBC count. These drugs we stop or drastically reduce their dose, and we temporarily increase the dose of steroid, which acts as a treatment of COVID as well as the act as an immunosuppressive agent to prevent the rejection in transplant patient. So what I suggest when a person of post after transplantation develops COVID infection, they should immediately contact their doctor on the first symptom so that we can investigate them and stop the bad drugs and increase the good so-called good drugs, not a good drug, but so-called in COVID scenario, that is a better option that to increase the dose of steroid and stop or stopping the mycophenolate or azathioprine group of drugs, and if needed, even decreasing the third drug that is either tacrolimus or cyclosporine. So consulting the doctor at the earliest helps a lot for the management, and the outcome can be changed. Whosoever patient after transplantation has developed COVID infection, those who I have treated, those who have consulted me very beginning, they all survived. It is only the delay which creates trouble. This is true for people who are on dialysis, true people who are on after transplantation, and even for common people, those who do not have a kidney problem. Diagnosing the disease at early stage, definitely many options are there to cure the COVID infection. It is not that there is no treatment. We can certainly decrease the death in COVID infection. There is no definite antiviral agent, but we can certainly decrease the death if we can diagnose the patient at early stage.
Thank you so much, Dr. Tarun, for your time this evening. We hope our viewers could get help from your informative views. This was a very enlightening session. To our viewers, please reach out to your nearest specialist doctors to get a personalized consultation on your health. Librate is also here to convey true and authentic information during this COVID era. This marks the end of the current session. We will be back with more information in the next. Till then, stay tuned.
Thank you very much.